There we go.
Head northwest on San Timoteo Canyon Road toward Carriage Trail.
Okay. Amazing. We are following your trip.
Amazing T. We're traveling with you, it seems. Okay, so welcome. Good morning from Nigeria, and welcome to Medical Mondays with Dr. O, where we share current and contingent medical information by specialists in different areas. Today, we have one of our very own, one of our favorites, Dr. Oluwole Ajagbe, who will be discussing some depth regarding dental health and our health. It's a lot he's going to be talking about tonight, including mouth breathing and, the list goes on. Well, I am Dr. Toyin Okwesomi, a family practitioner, HIV specialist, and I also treat addictions in Maryland. Though I'm currently in Nigeria, if there are any issues with internet and stuff like that, bear with me. I'm apologizing before we start, but I know that Dr. Ajagbe is very capable, and Dr. Ephraim Ajay to fill in the gaps if anything happens during the broadcast. So, Dr. Ajagbe, over to you, sir.
All right. Good evening, everyone. I hope everybody is able to log in easily with the FYI that you have to register again. I think that shouldn't be a deterrent for anyone to join us tonight. Anyway, I'm very excited to spend this moment with you. For those who have always, been present on every Monday program, I want to say thank you for your support and your camaraderie with us and on a weekly basis. And I know there are some new people that joined us today from across the world. So I want to say thank you, welcome, and let's see how we can make this evening a very exciting evening. Now, I'm not going to share slides. I'm not going to share anything. I just want to try and discuss some things which you may know or which you may not know, or maybe you've seen it or you heard about it, but don't know how this can be, taken care of. So I'm going to talk to us tonight about a cutting edge aspect of dentistry. This is an emerging field, and it's called the Airway dentistry. And so for those who do not have a clue what that means, it means a way of using a part of dental practice as a way of intervening to manage some of these chronic conditions that seem to affect our overall health, as well as the well-being of individuals who are suffering. So let's take a look. The topic is kind of like a question. So can airway dental intervention address or help to mitigate some chronic health problems? Like Dr. Ho was saying, the list goes on, but we're going to have to take a few just for us to be able to do the discussion within the time limit that we have. So let's take a look at mouth breathing, sleep disorder breathing, grinding of teeth, which we call bruxism. We have situations like upper respiratory restriction, We have, which means people with constant nasal blockage. That is, they don't breathe through their nose because their nose is always blocked, so they have to breathe through their mouth. And most people that are in that condition will definitely have problem when they sleep. And they have situations that we call the obstructive sleep apnea. It is that physical obstruction from the tongue and the swellings of the tonsils and the adenoids, and creating a closure of the airways in the back. So there's always been a correlation or a connection between sleep deprivation or poor quality of sleep and so many conditions, which will include, but not limited to, diabetes, high blood pressure, depression, ADHD and ADD, as well as nocturnal enuresis, which we call bedwetting. So tonight, I just want to try to see if I can interest you or just let you know that there are ways now by which these conditions, under multidisciplinary approach, including the airway dental interventions, people suffering from such conditions can truly be helped. So let's take a look at upper respiratory restriction or upper airway restriction. So what are we talking about? Usually when somebody has what is called the upper airway restriction, we are talking about somebody who has narrowed opening of the nasal cavity. That is, in the two nostrils are almost completely blocked, either because the space is very small and the speed of air going through this narrow space has caused the lining of the nose to become thickened over time. And so in most cases, such people cannot truly breathe through their nose continuously without having to use their mouth as an obligate, like a default to breathe. Now, when somebody has such condition, which we call the upper airway restriction, they are very uncomfortable. When they are awake, they're uncomfortable. When they sleep, they're uncomfortable. And the problem is, once the nose is blocked and the air that is supposed to go to the lungs is not prepared the way it's supposed to be prepared physiologically to be safe for the lungs, then the problem goes on, because the patient now, or the individual, will have to default to breathing through the mouth. And when the patient breathes through the mouth, the air going through the mouth to the lungs is not prepared. Now, let's take a look at what does that mean? What does that really mean for the air to be prepared? There are 5 things that take place when we simply just inhale. As you sit down and you are breathing in and you're breathing out, the moment you breathe in, the air that goes through your nostrils will have to go through 5 different processes in order for it to get to the lungs safely. The first thing is the air that we have in our nostrils, very fine, and they are all directed in different directions. Those hairs are for filtering. So let's say you are driving on a dusty road and there's so many things flying around. When the air goes through your nostrils, most of the particles will be trapped, okay? So that is one of the functions of the nostrils. Without that, if the air cannot go through the nostrils, then the air going into the lungs will not be purified in that form. The next thing that the air does is, when it goes through the nose, because of the narrowing of the nose, the speed of the air going into the lungs is increased, depending on how narrow the space is. Now, if it's very narrow and you force the air through, you definitely will have a form of injury to the lining of the nostrils. Okay. So once the air goes through the nostrils, it's also that the second thing is that it is warmed. That is, the temperature of the air is raised to the normal body temperature. Because if the air going to the lungs is too cold, it causes irritation, and the individual would definitely cough. Will have certain discomforts with the cold air going directly into the lungs. So the nose will warm the air so that it can be comfortable to go through to the lungs, and the lungs can then be healthy on a normal, simple daily living. Now, the third thing that will happen in the nostril is humidification. So when the air gets in, the lining of the nose in the back is very soft and it's usually very moist. The moisture is what helps to moisturize or humidify the air that goes into the lungs. Now, if you breathe in very dry air, along the way is going to dry everything, every lining that is along the way to get to the lungs, if there is no moisturization or humidification of the air. And that will cause irritation of the lungs and sometimes will lead to pneumonia. The next thing that happens in the nostril is the release of what we call the nitric oxide. The nitric oxide is a gas that is released from the sinuses, particularly the maxillary sinuses, in order to make the air going into, first of all, it would disinfect the air going into the lungs, as well as causes the blood vessels, the very small blood vessels that we call capillaries, to be able to open up and let the gases to go across the wall, just like oxygen going into the bloodstream, and then the carbon dioxide is coming out, so that we can exhale that. And when we inhale oxygen, and oxygen goes to the lungs, goes to the bloodstream, and then carbon dioxide comes out. And that cycle goes on each time we breathe. We take a breath, whether we hold our breath. As soon as you release your breath and you take in some oxygen, it will go into the bloodstream and the carbon dioxide will definitely have to come out. Now, this maintains a balance. So now you see the importance of the nose. Imagine the nose now not functioning the way it should, either because of developmental abnormality, where the nose is so narrow that, in fact, you wonder whether any air can go through those nostrils. And sometimes, because of the nature, the developmental abnormality, the nasal septum, that is the division between the right and the left nasal cavities, can be deviated. And if it's deviated to, let's say it's deviated to the right side, that means it's going to block the airway on the right side. And all the air that is needed for that human being will want to go through the left nostril. And that means there will be a lot of speed of the air going through, because it's narrowed, as well as needing a lot of air to go through. So that speeds up kind of accelerates the air that goes through that left nostril, and that causes some trauma to the lining of the nostrils. And that eventually causes the place to also shut down. So now that takes us to the mouth breathing. Mouth breathing, because the nostrils are not functioning, every human being is supposed to breathe through the nose for normal, healthy living. If you're unable to breathe through your nose, you are not going to be healthy. Well, in every way possible, that individual will not be healthy. So now let's take a look at what happens when the mouth becomes the default source of oxygen. Anyone who is mouth breathing cannot breathe the normal breathing. They will breathe through the chest rather than through the diaphragm. So the person that is breathing through the mouth is said to be hyperventilating. So they breathe shallow and they breathe faster. Not only are they doing that, the air that is going through their mouth is not filtered. Everything that we talked about going through the nose is not going to happen in the mouth. So the mouth will dry up very quickly. The throat will dry up very quickly. And the dry, dirty air going through the tonsils as well as the adenoids will cause them to become inflamed. The inflammation of the adenoids and the tonsils will cause obstruction because part of the way the tissues of the body respond to inflammation is swelling. Now, imagine the size of adenoids when it's inflamed on the right side and on the left side, the tonsils, everything that surrounds the opening that we call the pharyngeal opening. All the lymphatic tissue that is around there that is swelling because of the inflammatory process will further obstruct airflow to the lungs. Now, remember, the air going through the mouth is not clean. It's going into the lungs that are supposed to be sterile. So when it gets to the lungs, it's going to cause trouble. So if there is pollen, if there is dust, if there is bacteria, if there is virus, all of those now will converge in the lungs and cause problem. Now, why is this the problem? Why is this happening? All of this is happening just simply because the upper jaw is not fully formed. Now, if the upper jaw is not fully formed, there's a whole lot of havoc that is going to happen to that individual. The roof of the mouth will be so shallow, will be very deep and narrow. The lower jaw will be pushed to the back because there's nowhere to go. The tongue, having no room in the roof of the mouth, will be pushed to the back of the throat. So now that individual is not comfortable during the day and is not comfortable during the night. What do we think will happen to that individual on a daily basis? They are very tired, they are weak, they are unhappy because they are not really sleeping well at night. They're not very happy during the day. They have excessive daytime sleepiness, and they have poor oral hygiene because the moment they are breathing through their mouths and the mouth dries up, they will form plaque quicker than somebody who is breathing through the nose. So when you observe somebody who is breathing through the mouth, the best thing to do for them is to get to the root cause of this problem of mouth breathing and stop it. Because if you don't stop it, all other chronic problems will come upon that individual. And it can be stopped very easily just by consulting the right people who have the right understanding. The ENT doctors may observe it, but not knowing exactly what to do other than want to do surgery to remove the adenoids and the tonsils. But the airway dentist, somebody who is knowledgeable about craniofacial problem, will be able to help such individuals. So as part of a multidisciplinary team that support our approach to manage people with this problem, an airway dentist is very important. Now, let's look at another thing. So we've talked about mouth breathing. We want to stop it at all costs so that the individual should be able to breathe through the nose. How do we intervene as dentists or airway dentists? As an airway dentist, we can help to grow the jawbone to its full potential. And one of the ways to do that is just to to grow, to spread the roof of the mouth that is like a steeple of a church, like a church ceiling. You want to make it wider and flatter so that the tongue can actually rest on the roof of the mouth. The proper location for good health of the tongue is at the roof of the mouth at rest. So as you are listening to me, try to close your eyes and figure out and kind of just visualize, where is my tongue? If your tongue is not resting when you are not talking or eating on the roof of your mouth, with the tip of your tongue just below the neck of the front teeth, then your tongue is in the wrong place. Now, if your tongue is resting permanently on the roof of the mouth when you are at rest, it means you are breathing through your nose. Wow. Because if you don't breathe through your nose, the tongue will not stay there because it has to crack up in order to allow air to go through. So, congratulations to everyone whose tongue is resting on the roof of their mouth. It means you are living a healthy life. All right. So we move on to sleep disordered breathing. For most people who have problem breathing when they sleep, we cannot call it obstructive sleep apnea unless there is a physical obstruction. So anyone who has sleep disordered breathing, whether they wake up quickly or because they can't breathe, and it's not because there's a physical obstruction, and that's the one that we call the central central sleep apnea. The brain will wake them up and say, yeah, you stop breathing. Okay, wake up. So sleep disordered breathing is like an umbrella term. There are several different conditions that could be under that umbrella. But the outcome is still the same. If you constantly are aroused to wake up so you can breathe when you stop breathing at night, definitely your brain will not get enough oxygen. Number two, your brain will not be totally rested. And if your brain does not rest and it doesn't get enough oxygen through the night, definitely when you wake up in the morning, you are bound to wake up with headaches. And most times, for those who have obstructive sleep apnea, they will be grinding their teeth through the night. So when that happens, the person wakes up in the morning, jaw ache, headache, tiredness, and then of course they want to stay awake. If they must stay awake, they would be on Red Bull or many cups of coffee. And yet, with that, they will still be sleeping. They will still be very sleepy because the body is still saying, I am not rested. So sleep disordered breathing is a very important thing that, important condition that must be quickly addressed in order for the individuals to begin to assume healthy living and be able to live, their full potential. Now, how does Airway dentists help with the sleep disordered breathing? We can use different appliances to make that happen. And one of them is the biomimetics, which I shared in the past. And that device allows us to use vibration to turn on the stem cells, that is, in the junction between the left and the right maxilla, that is the upper jaw. And then the vibration causes the stem cells to be turned on, and they can actually begin to be stimulated to lay down bone. And the bone that is laid down is actually the reason why there will be enough room created for the tongue and the roof of the mouth, and the nostrils will be opened up as well, because the nose and the jaw and the upper jaw cannot be separated. If you do anything to the jaw or lower upper jaw, it affects the nose, because the roof of the mouth, it coincides with the floor of the nose. So they share boundaries, and the walls of the nose, the bones of the side of the nose are extensions from the upper jaw. So you cannot separate them. All right, so now we've seen sleep disordered breathing. If we put the appliances and we grow the jawbone, actually every human being has the potential to grow enough bone, the jaws, to create enough space for 32 teeth. That is 16 on the top and 16 on the bottom. So if you don't have enough space, there is no doubt that you do have developmental abnormality of your upper jaw, and definitely it affects the lower jaw as well. So if we corrected the bone, many times, because patients have been used to the abnormal positioning of their tongue, it is obvious that they will need help. They will need certain training for them to be able to know where to position their tongue. Now that they have space, where should they put it? They don't know, because their tongue has never been in that position before. So now there's what we call the myofunctional therapy, which is a new, it's not really new, but it's a form of, functional therapy that focuses on the positioning of the tongue. A speech pathologist could actually be also a myofunctional therapist who can help, not just helping the patients to know how to pronounce words, but also to learn how to swallow. Because most of the time, many people don't even know how to swallow properly. Since they don't know the difference, the way they've been swallowing seems to be normal to them, but until they are trained on how to use their tongue properly, they will not know the benefit of myofunctional therapy. So that is something that you need to remember. Myofunctional therapy is very important aspect of the management of anyone who has this kind of condition. Now, let's talk about bedwetting. When a child, I'm sure adults too may bedwet, but we're going to focus more on the children at this point. When a child has sleep disordered breathing, one of the ways by which they manifest that is bedwetting. And everyone who experiences obstructive sleep apnea or central sleep apnea is experiencing what we call sympathetic nervous event, which then means everything that happens when the sympathetic nervous system is stimulated will happen in that individual in an instant. And the way to describe that is the fright, flight, or fight. What you can call, pretty much is like, I'm looking for this word. It's like something that occurs spontaneously or automatically. So that's why it is called autonomic nervous system. So it's kind of just like a reflex. When the brain arouses somebody to wake up, they wake up without being aware of where they were or where they are, but everything that goes on with being afraid comes to play. So now their blood pressure will go up transiently, and they are scared, not being aware of where they are, but all of these things are going on pretty much subconsciously while they are still half asleep, half awake. So one of the ways by which it happens is the bladder will become stimulated by the sympathetic nervous system. And that creates a situation where the child feels he has to void, that is, the bladder is full, even though the bladder may not contain a lot of urine at that particular moment in time, but it will feel like it's time to pee. But the child doesn't know that he's not awake, doesn't even realize that he's still laying down. Well, the bladder will be released and there will be pee coming out. And sometimes just the wetness will now make the child to become aware of his environment and, want to get up. But some children will sleep through all of that. They will not even know that their bladder have released the urine inside. So how do we help such patients? First, we must recognize the root cause. The root cause is sleep disordered breathing. And we can easily identify that by doing the questionnaire, the survey, the sleep disorder assessment questionnaire. As simple, it doesn't take more than 2 minutes at the most. And the score will actually help to know what the child is going through. So once this is diagnosed, the sleep disorder can then be confirmed by doing a sleep test. Now we have a device that can actually help children to do sleep tests. Before 2 years ago, it was difficult to get sleep tests for children, and even in the sleep lab. But now with this device, a child can wear a ring, simple ring, and be able to go to bed and sleep. And then the sleep disorder can be monitored and be diagnosed, and then the child can be treated. Because once you rectify the problem of sleep, the child now doesn't have to go through the sympathetic nervous event that usually occurs during the sleep apnea. Now, the next thing that we're going to be talking about is the ADD, that is attention deficit disorder, and the attention deficit hyperactivity disorder. Now, these are psychiatric diagnoses that need to be made. However, there's science, there's so many research data to support that the root causes of the ADD and ADHD is nothing more than sleep deprivation. And most of these children, once their sleep situation is rectified, either using devices to open up their airway or other things that may be causing the sleep disorder, breathing is identified and taken care of, most of these children are taken off of medication right away. They do not have any distractions anymore. They do not have any problem focusing or paying attention in school. So, and then let's quickly address the issue of depression. Now, poor sleep quality and the resulting chronic fatigue that follows poor sleep have exacerbated the depressive conditions or symptoms. So as an airway dentist, if we observe any physical any physical cause, as in the case of narrow upper jaw with a deep roof of the mouth, crooked teeth, and the tongue that is tied to the floor of the mouth. And all of these things can be diagnosed even in adults, not only in children. So when we observe things like this, an airway dentist can bring forth or contribute a whole lot to help that patient to become released from the depressive symptoms, just by simply improving their ability to sleep well at night. So at this point, I know that I've said so much, but there's still a lot I didn't want to, confuse the listeners by, that I'm going to leave to the time of question and answer. So at this point, I hand over back to you, Dr. O. Hello, Dr. O.
Thank you so very much. That was loaded. That was loaded. Dr. Ajagbe, you didn't do justice to every single one of them, but you hit the important points. So I'm interested in that bedwetting and disordered sleep.
Mm-hmm.
If you please, shed more light into it, how disordered sleep will lead to bedwetting in children. And also I can see how ADHD would occur, because when one does not have good sleep night after night, we know what it does to us also. However, can you shed more light into the bedwetting stuff? And if you have any questions, please, in the audience, raise your hands or ask them in the chat box. Thank you.
So it's a nervous situation with bedwetting. If you grew up in the part of the world where I grew up, they always said, oh, the child is too playful. It's always too playful. So in the night when he's sleeping, maybe he thought he's still playing. That's why he wets the bed. No. Some people will say, oh, no, the child shouldn't drink water so much before going to bed. Well, all those could be superficial interventions. But what normally happens is is an autonomic nervous situation. I use the word autonomic because there is no substitute word for it in a layman's term. And it's simple that something happens automatically. It's just like, let's say somebody wants to face an exam or somebody wants to go for an interview. Well, if that person is afraid, that is called fright. So there's an event that is going on inside that human body. It's similar to what happens at night when a child is not able to breathe well. Most of the children that have the sleep disorder breathing have nasal blockage most of the time. You've seen children that they are constantly going, they can't breathe very well through their nose because their nostrils are partially blocked. And if the nostrils are fully blocked, they must be mouth breathers. And when they are mouth breathers, their tonsils and adenoids must be swollen. And when they are swollen, the airway is further compromised. And so when they go to sleep, their tongue falls to the back. The tonsils and the adenoids have already closed the space. So the child is struggling through the night. Now, the way you look at it is this. If a child is woken up at least 10 times per hour, and the child sleeps for 8 hours, that means that child has been woken up 80 times. Each time that child is aroused by the brain to start breathing again, when it stops breathing, part of the response that the body goes into is the fight, fright, or flight. And that is where this sympathetic nervous system is stimulated. And one of the side effects, one of the outcomes of that is the bladder control. So the child is asleep, it doesn't even know that the brain is waking him up or her up to breathe. But the autonomic nervous system is doing all of this work in the background. The child doesn't know nothing. So the bladder loses control at that point. So the fluid inside the bladder, whether it is a lot or very little, it doesn't matter, it will just be released. When we want to use the bathroom, we want to urinate, it is a voluntary action. But when a child is sleeping, and is aroused because he or she has stopped breathing, and the brain says, wake up, you stop breathing, you need to breathe. And part of the thing that happens is confusion. Even if you woke that child up, for those parents who try to wake their children up to go and use the bathroom at night, you know the problem that you face with that. They are confused, they are half asleep, half awake, they can't even stand straight. And then when they even try to pee, they are peeing everywhere because they cannot control it. So if it happens while they are not conscious, the chances are that they will pee wherever they are sleeping. So, and we now know through scientific research and data to support the fact that if we can help the child breathe, a child that has asthma, chronic asthma, severe asthma, that has tonsils and adenoid swollen, that's gone for tonsillectomy and adenectomy and is not relieved, it still has nasal blockage all the time. All the medications are not working. And then to even complicate that, many of these children have problems in school. So now imagine in a culture like Nigeria, in Nigeria, where a child at bed wet, is kind of like despised. Is despised to the point that they think it's his fault or our fault. They think he's careless, he's lazy, what's wrong with him? Why can't you wake up to go and use the bathroom at night? No, it's not their problem. It's not their fault.
Turn right onto West Park Avenue.
It's something that is going on in the system that needs help. That child is crying for help. So rather than spanking and abusing and shaming and all of these things that go on with bedwetting, that child needs love. That child needs compassion. That child needs to be diagnosed accurately and treated well. So I don't know if that addresses what you're asking me to do, but if anyone who has a situation that wants to discuss it further about bedwetting of a relative, well, I'll be glad to talk to that individual if Dr. O will share my contact information, because really there's a whole lot around the bedwetting issue.
Thank you, sir. I have a question that was a long one, and I just asked that it be reposted to me, but it wasn't reposted. It was from Herman in England. And Herman, I don't know if you'll ask it yourself. I got disconnected, and when I came back, the question, I've of course lost the question. It was talking about, oh, here we go. He said when he was a teenager,
I think she's frozen. Internet, network.
Let's ask Dr. Emma to kindly state the question so Dr. O can join later. The professor can answer. Thank you all.
Hello, can everyone hear me? Can you hear me?
Loud and clear. Beautiful.
Yes, hear you.
Yeah, hello. I'm sorry my camera isn't working, so I'm sorry if it's a bit impersonal. Yeah, all it is when I was a teenager, I had my 2 nostrils cauterized because I used to have issues with regard to sleeping, in particularly breathing, but it actually caused nosebleeds. But that solved the situation. Yeah. However, what I've learned now in sort of adult life, I've really since COVID, to tell the truth, I use a mask over my mouth to breathe in. But I breathe out through my nose. That works quite well because in London, I suffer with hay fever, but in London we have one of the highest sort of pollution rates in Europe as well. Yeah, so that tends to irritate me. That works well for me outdoors. Yeah, but according to your test, my tongue lies in the right place. Yeah, so thank you for that. However, I have high blood pressure, and I do wake at night with regard to going to the toilet about 2 to 3 times. Yeah, but this really leads to me not having really, I would say, enough sleep. I don't get 8 hours sleep. Let's say I get about. I know I don't get a solid 4 hours sleep. I know that definitely. So there's issues there. So I'm quite tired, basically. A lot of the time, I'm quite tired. And I do have high blood pressure as well, which is coming under control. I'm just thinking, there's a few things there. What suggestions you could actually sort of possibly suggest? What could you possibly suggest? And I'm someone now, sort of middle-aged man now, so I'm no longer a teenager.
Well, thank you for the question.
And I wasn't a bedwetter. I wasn't a bedwetter. I did not wet my bed either. Apparently,
it's okay.
Which
Good.
I know, if that's one thing, if you did in the West Indian community, you got severely disciplined. It's quite interesting to hear what you're saying here with regard to the tolerance of actually trying to understand the subject matter. Yes, but so thank you for that, and I definitely will be using that talking to individuals and in some health groups as well. You've really opened up my mind actually with regards to that. I'm really enjoying the presentation. So I don't want to take too much time because I know there's other people, but in a way, what possible suggestions do you possibly be? Thank you.
You're very welcome, Harman. It's pretty much something that you have to consider. Okay. If you wake up several times at night to use the bathroom, it could be one of those signs, because that's one of the manifestations of obstructive sleep apnea. Okay. So if your body says to you, you need to wake up and go use the bathroom, it's a way for you to actually move your jaw forward so that the tongue that fell in the back, closing the airway, is moved out. So for some people, that's the only way they can get aroused, to get up. And if they don't get up, they'll get lapsed back into that sleep apneic phase, and the brain will say the same thing, get up. And so for some people, as you know, they may have it maybe once every 5 times that they stop breathing, that they will feel like using the bathroom. Yes, if you do wake up frequently at night, you will not get enough sleep. And if you don't get enough sleep, you're going to be grouchy in the morning. If you're grouchy in the morning, you are fortunate that you don't have a headache. Most people will have headache. Not only will they be grouchy, they will have headache, they will have jaw pain because they've been grinding or clenching their jaws through the night in order to keep the airway open. So now, if you still have high blood pressure, it means the root cause, of your breathing disorder is not really addressed. Okay, so yes, they did cauterize your nostrils when you were a teenager. The reason they did that could be 2. 1, because you had a nasal polyp. That's something so somebody who's constantly having, respiratory problem in the nose, either because the nostrils are not open properly because the jaws are small, they may develop what we call the polyp. It's kind of like redundant tissue that is formed from repeated irritation to the lining of the nose. And that can vibrates. Each time you are breathing, it vibrates. And when it vibrates, it tickles your nose. You are uncomfortable because you can't sneeze you feel like you need to sneeze, but you can't sneeze because there's really nothing foreign there except that is your own tissue that is vibrating. So it's very uncomfortable. So, and for some people, that polyp becomes, a bleeder. So once because it dries up, the surface dries up and it cracks. Once it cracks, it causes bleeding. And when you get bleeding, you get what they call nosebleed. They tell you to hold your head back so it doesn't drip all over your face or all over your body. But an ENT surgeon will go in there, take a look and say, oh yeah, we found the problem. And then they use either chemical cautery or they use a diathermy. I mean, it's like a electrical device that they use, zap it and then, kind of close the blood vessels or use it to cut off the polyp. Now, if you're still having a blood pressure issue, it definitely means that the root cause of your sleep disorder is not being addressed. Now, I don't know what your jaw looks like, your teeth. If your teeth are lined up and, both upper and lower are lined up without orthodontics, that is without using braces or anything, it may not be that you have major deficient jaw development. But since you already told us that you had a lot of problem with your nostrils when you were a teenager, it definitely proves something that your nostrils were not big enough to accommodate the kind of air that your body needs. So since we are not establishing any patient-doctor relationship on this program, and I don't know the full story about your ENT situation, so I may not be able to address so many things, directly or specifically. So my suggestion to you would be, I don't know how it is in the UK, if you have people who say, I'm a sleep doctor. So you go to that sleep doctor and they can sit down and truly analyze your situation and say, okay, well, we know definitely if you sleep better at night, your blood pressure will go down. Definitely. Unless there are other causes. If there are no underlying causes, then definitely if sleep was the root cause, once your sleep aspect is corrected, your blood pressure will automatically just come down.
Okay, doctor, can I just intervene? It's excellent what you're talking about. I don't want to take too much more time. It's quite apt, quite timely for me because at this present moment in time, I'm actually having some dental work. I actually have to get one wisdom tooth removed. And I spoke to my consultant the previous week who's asked me to try to get myself referred to. There's a hospital in the UK, I'm not sure if you guys have heard, called Guy's and St Thomas's Hospital, with regard to sleep clinic. So they've told me. So what your last suggestion there has been spot on because I've been suggested that is one thing I should do a week ago when I saw my consultant, but my GP is away for about 2 weeks. I have to get referred through the GP. Thank you very much for your, I would say, consultation. Yes.
You're very welcome.
And I definitely will be dropping the doctor a line with regard to yourself. Thanks for that. And actual fact, and I'll let you know the follow-up as well. Seriously.
It's okay.
God bless you. Really appreciate it and really enjoying tonight. It's really opened up my mind. It's very timely for me because these are issues I'm actually living and going through now. Wow. So thank you. Appreciate it.
I'm glad you could be helped today.
Fantastic.
Thank you very much.
Herman,
hello.
I wanted to add that, doing an allergy panel will be life-changing for you. You need to ask your GP if you have that in London to do an allergy panel, both food and environmental. And the first step in treating allergens is abstaining from what you're allergic to. So once you know those things you're allergic to, then you can abstain from them. That would be life-changing. Some people would have allergy problems. They would think they have the flu sometimes. I mean, it just makes life miserable. So yes, your problem may be sleep apnea. And if it is, or sleep disorder of some sort, then, once that is resolved, it may resolve your blood pressure problem, but it will not do anything about the allergens. And so you need to take care of that.
Okay.
Another thing is that there are many factors that could have caused your blood pressure. May not even be related to what you're thinking. So diet is very important. Decreasing salt intake in your food, meaning once food is cooked, don't add any more salt. And if you are cooking it yourself, go easy on salt. Increasing fruits and vegetables is also important in decreasing your blood pressure. And exercise is a big component of decreasing your blood pressure. Another thing is reducing or eliminating dairy products, like cheeses, the milks and stuff like that. You can change to things like almond milk, oat milk is what I want to say. It's a new one that I just found not too long ago. Oat milk, but there's almond milk and there's also coconut milk that you can use instead of the dairy ones. So all of those things will decrease your blood pressure. Lifestyle changes are very important. Okay?
Okay. Listen, that's absolutely fantastic. Some of the things there with regard to the veg, the fruit, the salt, the diet. I don't do as much exercise as I used to. The legs aren't as flexible as they used to be, but that's been lazy. But yeah, thank you very much. I really appreciate that. I really feel you guys are in there
You're
with me.
welcome.
So I appreciate it. God bless you. Thank you.
You're welcome. Amen. Thank you.
I will keep
Dr.
you in touch
Duyebo.
as well. I will keep you in touch. Yeah, I will update
Okay.
you guys as well.
Fantastic.
Yeah, thank you, Amen. Let me quickly add one more thing. So you mentioned that you are going for wisdom tooth extraction, right?
Yes.
Okay, so the tooth that you're about to extract, is it because it's bad or is it because they think it doesn't have space?
No, it's seen better days. It's cracked. It's old and cracked.
Okay, so definitely there's no hope. Once it's cracked, there's no hope. The reason I raised that up is that for almost 120 years of practicing dentistry in the US, wisdom teeth have been extracted regularly. But research has demonstrated that is actually not necessary. If there's knowledge enough about growing the jawbones, that the jawbone can be grown at any age. And so the potential for everyone to have enough space for 32 teeth is there in everybody. But it's just that we must stimulate it, and that is why we use biomimetic. No infusion of any kind, is just using normal vibration that occurs like when you chew, when you talk, and all those things to turn on the bone growth. So, and there's a ton of reports to show that this has worked. Actually, people that should have had their wisdom teeth pulled didn't have to pull their wisdom teeth any longer.
Haman, in your case, it's cracked, take it out. So, Dr. Duyebo, you have your hand raised and ask your question. You're welcome.
I'm sorry, that was an accident.
Oh, it was. Okay. We'll lower that end. And Auntie Susan Oshifade said, Dr. Ajagbe, thank you for the breakdown on the topics. Is trimming of the nostrils, ears advisable as we do it for cosmetic reasons or purposes? Trimming of nostrils, ears, is it advisable?
Okay, well, if it is becoming an eyesore, well, why not? You can trim it. But you should not go inside the nostrils and shave it clean because you want it to look fancy. No, the hairs are important. Now, I've seen some people that their nostril, the hair from their nostrils is as long as their beard. So those ones may be necessary to trim if it's becoming an issue, particularly if they have a mucus always stuck on it. So it may not be hygienic to have it too long, but don't go inside the nostrils. I've seen it done, and I think the Hausas in Nigeria usually do that. People will go to these mobile barbers, they carry their shaving stuff, and you see them opening their nostrils and shaving it inside. I'm like, oh my gosh, this is serious business. But we need the hairs in the nostrils. So you're very correct, madam.
So it is not advisable, correct? Because
No,
the ears actually.
It's not advisable to shave it. It could be trimmed. That's what I'm saying. It
The
could be
ones outside.
it is sticking so far outside that actually things are getting stuck in it, external to the nostrils. Then definitely you need to trim it down. So I'm just saying it's for health reason that you don't want it to be too long as well.
Thank you, sir. So the nostrils in the hair are there for a purpose. They actually protect us from breathing in things we should not take in. And for smokers, we always encourage that they stop smoking, because one of the things that cigarettes smoke does is it actually destroys the hair in those nostrils and allows things that should not be breathing to be breathing, causing them to have frequent things like bronchitis, infections, and stuff like that. So we advise that people should stop smoking because of that. So again, I will reiterate that shaving inside the nostrils is not advisable. Yeah, if the hair is sticking out, you can trim that outside of the nostrils, but the hair inside is very necessary for good health. God put it there for a purpose.
Absolutely. Mm-hmm.
So, any other questions? I think tonight I actually, jinxed myself by saying something about if there are internet, troubles, Dr. Ajagbe and Dr. Ajay will fill in. Actually got, cut off a couple of times, which never happened before. I've streamed from Nigeria, from many other countries, but I don't know what the internet has been doing in Nigeria for the past 2 days. It's been very interesting. So pardon me that, I was going in and out. Any other questions? If there are no others, Dr. Ajagbe, if you please give us your parting words for tonight, we will round up. But before we do that, I want to acknowledge somebody on the forum. If he's still here, yes, he is. For Medical Mondays moment, that's Mr. Chris Otaigbe of, he actually is the Nigerian counterpart to the MAVTV. I hope I got that right. He can correct me. They covered my mom's funeral for the 2 days in Lagos and the 2 days in Abeokuta, and I'm grateful. I also would like to acknowledge NAPAC by way of our own CEO and Madam VP, Auntie Lara Okunobi. Right there at the church, I was surprised by a wreath, fresh flowers sent by Madam CEO Lara Okunobi on behalf of NAPAC. And I'm so grateful. That's my Medical Mondays moment, just so you know, appreciate this too. And one more, Dr. Ajagbe, who flew in personally to join us at Mom's funeral, service of songs funeral. Dr. Ajagbe was on ground and had to fly back on the funeral day because he had a program, you know, on Saturday, Sunday, what day?
Yeah, Sunday and today.
So, and thank you so much for the outpouring of love, of greetings, phone calls, text messages that I've not been able to respond to. I appreciate you all. Thank you. Amazing T, thank you for checking on me frequently. Appreciate you all. Thank you. Dr. Ajagbe, your parting words, sir.
Okay, so for those who do not know that there is help and hope for those people who have been tagged as these are, you know, lost causes, you know, particularly a child that is bedwetting till maybe 14, there's help. I mean, you just have to find out what is really the root cause of this. Now, we're not saying those children that have developmental abnormalities of their bladder, and that can be diagnosed by their urologist or pediatrician, or a child that is constantly having constipation. We know that if a child is constipated, that will put pressure on the bladder, and that can cause the child to urinate at night. So that seems to be a troubling part. I'm not sure as that has been addressed properly in many cultures. And hopefully, as things are coming out, we'll be able to help, you know, take away the stigma that people have on children for bedwetting. Any other thing that has been identified is not, I can say that the list is inexhaustible. But most importantly is just to recognize that there's help. And the help is multidisciplinary. It's not one person does everything. If I, for instance, if I give somebody an appliance to open up their airway and they do not know how to use their tongue, a myofunctional therapist will need to be there, you know, and a sleep doctor would need to be there to also verify that this person is out of the woods regarding their sleep, or, you know, apneic issues or sleep disorder. All of these things are very important. And so it's a whole human being, because the goal is that we will all live healthy and very fruitful life. You know, that we will not just be limping through life because of certain things, or which I could call ignorance or willful defiance to what can be done. So thank you all for your attention, and I'm glad we could have this discussion tonight.
Thank you, Dr. Ajagbe.
Mhm.
We appreciate you beyond words. Haman says, this has been very insightful and it will keep you informed on its progress. So till we meet again next week, Attorney Richard Williams also says Thank you for your excellent presentation as always. And Sister Toyin Fakoya, thank you very much that she has gained a lot too. Thank you so much. And thank you everyone for showing up and participating. See you next week. Till we see, keep safe and God bless you all.